stop nightmares with PTSD. We can see what is the nightmares in our life. It meant to be inner fears and anxieties, distress. Now we can take look for what is the PTSD. It meant post-traumatic stress disorder. PTSD is a psychiatric condition that may occur in people who have experienced or witnessed a traumatic event or series of traumatic events. When we dreaming in sleep, processing information about what happened during the day. Most of the nightmares and dreaming happens during REM, rapid eye movement sleep. It's a thought that the process of dreaming helps to consolidate memories linked with longer term memories. If you're stressed out during your day, you may dream about things that have stressed you in the past. They may be included in your dreams in some way. It's way of your brain trying to make sense of things that you have gone through during the day. If we consider nightmare, we have to take look about several factors. During the day, mind is trying to help you process traumatic events through introducing information to you, wondering about trauma when you don't want to, having images of the trauma when you are not meaning to think about it, when you are experiencing it is actually your mind's way of helping you to process what happened, to help you sort out why you are still distressed about what happened. That when these memories or these images are present to you, we tend to avoid, so we try to shut it down, not think about those things, and so we end up going through kind of this of approach and avoidance where information is presented is distressing, so we try to avoid it, and that's what actually keeps post-traumatic stress symptoms going for a long time, because we are just kind of stuck in the stance. Thought about the nightmares is that it is this same process that's just continuing on while we are asleep, that the mind is introducing these images and these thoughts and these emotions related to the traumatic event, because oftentimes people who have experienced a trauma, there the nightmares tend to be somewhat about the trauma, so never an exact replay of it, but it may be similar situations, circumstances. Some of the same people maybe who are around during the traumatic event, and so one of the theories is that this is a means of helping you to try to make a meaning of what happened, to try to understand at different level the traumatic event that happened. So nightmares, so your brain trying to dream bringing up nightmares is actually potentially your brains try to process through and work through the emotions and memories of the trauma, but something gets stuck, not actually processing to the end where it feels better. It keeps getting stuck and feels worse and worse. So what happens is that when we are having the nightmare, it gets to the most dysphoric point, which can be scary, but people also may feel shame or guilt instead of fear in their nightmares. Then we wake up, and so it doesn't conclude. When we wake up, people have very hard time, often time, falling back to sleep. They are losing a lot of sleep in this process by being woken up throughout the night, then not wanting to go back to sleep or not being able to, because it is so physiologically arousing, and after that next day we don't want to think about the nightmare, and so again we kind of go into that avoidance, and so we don't get to the point where we can process it, and that's how we tend to get stuck. So avoidance is a key feature of PTSD. It's also key feature of anxiety. We have to talk about avoidance as being the thing that keeps anxiety going. Let's look how do people avoid with PTSD or with nightmares, a process of suppression, just trying to push away in some manner, thinking about it, not talking about it. With PTSD, people tend to avoid people, places, and things. So, not only those internal reminders, the memories, the images that are coming up, but also those external reminders of the traumatic event as well. Example of who have traumatic experience in a room with a radiator, so she frequently avoid room with radiator. So that seems kind of a paradoxical because it seems clear, like if I have a phobia of, let's say, heights, then approaching that would be like upstairs to stand near balconies. I am going to face my fears with nightmares. We can move into the treatment aspect here. We look at avoidance. The antidote to avoidance is approaching, but how can you approach or face your fears with nightmares? Like that seems really hard when it seems like they are out of your control. They happen night or whatever. A lot of fears of sleep that gets involved with people who have frequent recurring nightmares. So they try to use substances that will help them fall asleep really quickly or put them in a deep sleep, hoping not to have any dream experiences. So, like drinking alcohol, using cannabis, like sleeping medications, all that, all of that, absolutely. And so the treatment involves there's a couple of different techniques, but there's a piece in which we expose have people do an exposure to the nightmare itself. We have them write it out, start to finish in first person, present tense, lots of details, really trying to engage that the emotions that go along with the nightmares. That one piece of the process in terms of how do you approach. If it's something that happening when you are dreaming, we do it right in the therapy session. You do it while you are awake in therapy with some support. Lot of people with good reason want to avoid these things that are frightening and avoid the physical sensations that come up, the anxiety, the crying, the shaking, all these things. First couple of sessions prior to that, a lot of psychoeducation that really helping people to understand why they are having the nightmares, how it related to the traumatic event. The experience of nightmares has been shaped the way that they think, the way that they behave related to sleep, and we start making modifications to people's sleep habits prior to that session where we are doing the exposure to the nightmares. We have to improve sleep hygiene and your sleep environment. Then after we can improve sleep quality, we have to do relaxation techniques such as progressive muscle relaxation, diaphragmatic breathing or belly breathing to help them reduce that cognitive and physiological arousal that people have prior to going to sleep, because that's if you are worried about having another nightmare, afraid of going to sleep, you are going into that experience with a lot of stress and a lot of arousal, like you are warm up your body to be anxious in bed, and that's going to make you are more likely to like accelerate that cycle, more likely to have a nightmare. If you are going to be asleep, this arousal and anxiety and stress and fear, when you are dreaming, your brain might be choosing things to match that emotion, and so it's going to reach for those very scary images, those very dysphoric images to kind of match how you are feeling in that moment. We have to aware people how to have a little bit better sleep habits, how to relax a little bit before bed, how to make their bedtime a calming experience. When we look, we are doing some exposure therapy. You are write down as a depictive way. Now we can see several steps how to step nightmares related PTSD. Humor can be a therapeutic tool in one of the way of facing fears. good social connection with others in the vital in trauma recovery. Sleep disturbances may happen in different sleep stages and require specific treatments. Seek professional help. Explore different type of therapy. Practice good sleep hygiene. Consider image rehearsal therapy to change the ending of nightmares during the day.